Welcome back to Healthy Life. In for Dr. Timothy Johnson, I'm Dr. Naina Sinha. Glaucoma is a disease that can cause blindness if left untreated. However, there is a new treatment that may offer hope to people suffering from glaucoma complications. It's called Canaloplasty, and here today to tell us about this new procedure is Dr. Bradford Shingleton, a surgical ophthalmologist. Welcome, Dr. Shingleton.
It's a pleasure to be here.
I guess we should start with, what is glaucoma? What is the definition of that disease?
Well, that's so important. Glaucoma is very much like hypertension. Just like we have a blood pressure, we have an eye pressure. If the blood pressure goes up, it's hypertension. If the eye pressure goes up, it's glaucoma. But the key thing, if the eye pressure goes up with glaucoma, it damages the optic nerve. And the optic nerve is part of the brain. And if there's damage to the brain and optic nerve, that can lead to irreversible blindness. But just like blood hypertension, unfortunately, glaucoma for the vast majority of people is silent. It can occur very slowly and silently, and people can actually lose vision and not know it's happening.
Okay, are there certain groups of people that are at higher risk for developing glaucoma? Is family history of glaucoma important?
Absolutely. Family history is very important. It very much is directly related to age. The older people get, the more common the glaucoma is, but age is an issue. There are certain associated findings, such as diabetes and other changes in the eyes, so it's critical that patients be seen by their ophthalmologist to check for the possibility of glaucoma, particularly if they have a family history of glaucoma.
Now, is there a cure for this disease, or is it really just persistent treatment?
Just like hypertension, there's no cure, but it's so critical to prevent problems with glaucoma because, as I mentioned, the damage is permanent. So that's why it's so critical to catch it early on in the disease, and that's where, in terms of a surgical approach, where we typically use medicines or lasers and then surgery, canaloplasty may be a very effective surgical approach earlier on.
So can you sort of go through with us the major types of treatment that are currently available, what you usually start out with, how it progresses?
Right. For the majority of people, we use medications, and this controls the glaucoma for most people. The issue with medications, as you might guess, they can be irritating to the eye, they're costly, and if anybody's like me, we tend to forget putting the medicines in, and that's a problem with compliance, so that's an issue. The next stage in treatment tends to be laser therapy, and this has been very effective. The problem with laser therapy is it does tend to be temporary. When medicines and lasers don't work, we do surgery, and typically our surgery in the past has actually been sort of a minor modification on surgery that was done literally 100 years ago in southern India by a Dr. Elliott. We haven't had dramatic changes since that time, and we actually make a hole in the eye to bypass the normal channel, and that controls the pressure for many people. The problem with that conventional type of surgery is that it can be associated with a pressure that's too low, a pressure that's too high. There can be scarring, leakage, infections, and that's the problem. And indeed, canaloplasty may be an advance over that traditional type of surgical treatment.
So can you sort of go over exactly what canaloplasty will do for patients?
Absolutely. In their eye, we've got, the reason we have glaucoma is because there's a normal, very tiny circular drainage channel. It's smaller in diameter than the tip of a pen. For the first, and that canal collapses, and it doesn't allow the normal flow in the eye to drain out, and the pressure goes up. That causes glaucoma. With canaloplasty now, with some incredible sort of microsurgical instrumentation now, this is all done under a microscope with high magnification, we're actually able to open up that canal, dilate it with a fine, very tiny microcatheter, and that helps restore the normal drainage of pressure in the eye in a more physiologic way. And so that lowers the pressure, but it also reduces a lot of the problems that are associated with the conventional surgery that we still do for many people.
And after patients have had this type of procedure, are they rid of their other eye drops, or is this used in conjunction with those medications as well?
Well, over 1,000 of these procedures have been done. In the original study that's still ongoing, of over 300 patients that have been done in Europe and in the United States, of which I'm a part of, the pressure has gone down by almost 50%, and just as importantly, the need for medications has gone down 80 to 90%. It's so important to understand that medicines, lasers, surgery, and now canaloplasty are not a cure. We don't cure glaucoma like we take out a cataract, but it's critical to control it, and now canaloplasty is certainly now an important adjunct in our set of being able to treat glaucoma from a surgical standpoint. So yes, there's usually a significant reduction in the medicines, but people need to be prepared to use them if necessary.
And do people have restoration of some vision that has been lost, or is it really just delay the progression of the glaucoma?
Overall, in general, when vision has been lost from glaucoma, it tends to be permanent. That's why it's such a silent and significant problem. It occurs without people knowing of it. So it is so critical to catch it before the damage has occurred. And that's probably where canaloplasty has an important role. If we can catch people a little earlier, before a lot of damage has been done, then they can sustain excellent vision, hopefully for the rest of their lives.
Well, thank you, Dr. Shingleton, for that very helpful information. I think it's important that we all really keep on top of our regular eye visits so that we can really prevent and delay these complications.
My pleasure to be here.
Thank you. I think that's all we have time for today. We hope you found this edition of Healthy Life informative. To find out more on this story and other health-related topics, we invite you to go to our website at abcnews.com. Thanks for joining us today. From all of us at the Healthy Life production team, we hope you stay healthy.